Hey, what's going on, Candelas? It is Dan Thomas with 8Z Real Estate and my latest episode of Spotlight on Candelas, where we put the spotlight on businesses in our Candelas area. And this week, we are fortunate enough to have Dr. Jenny Friedman with Westre Arvada Orthodontics. Thanks for joining me today, Jenny.
My pleasure.
Yeah, so we always like to start out, let's assume the brand new neighbor who just moved into the community yesterday might not know who you are. Who are you guys? What are you guys about? How long have you guys been in the neighborhood?
Yeah, so we are, Westre Arvada Orthodontics is the name of the business, and our motto is your caring neighborhood orthodontist, because that's really who we are. Our main value is that we are extremely caring towards our patients. Anything you need, we bend over backwards, do everything we can in our power to help you relax and make your procedures as comfortable as possible. But also, our other value is high quality. So if you come here, you know you're going to get the best treatment possible.
Yeah, perfect. And I know we're going to touch on some of the ways that you guys demonstrate that caring side here in a little bit. But I know your philosophy is really big on education with your patients. And that was a big reason why you chose and you guys were excited to open up in the neighborhood.
That's right. So one of a personality trait of mine is that I'm kind of professorial. And that's because it's important to me that my patients fully understand what their treatment plan is and why, and the full diagnosis. And so I like to educate each patient about exactly all of that. And so we chose this neighborhood because we knew in the demographics that a lot of people here do have higher education and would appreciate that part of our treatment. So, and it turns out we fit in great here.
Yeah, and that's probably uncommon, to make sure that your patients have full clarity before entering a process. I'm sure sometimes, people are just following the lead of the doctor, but that's really, against what you guys believe in.
Yeah, that's unfortunate. I have had a bunch of patients come to me for second opinions, and they're like, wow, the other doctor didn't explain any of this. Thank you so much.
Right.
So, and I even like to give progress reports at each appointment. So with our treatment, usually you see me every 6 to 8 weeks. And then I like to give you updates on how things are coming and what our goals are for each appointment.
Right. So I'm sure most people are thinking that most orthodontic, clinics are the same. So really, why are you guys the perfect or the better choice for members of our Candelas community?
So first of all, like I said, you're going to get the highest quality if you come here. And that is because I'm extremely experienced. I've been practicing for many, many years, even though this clinic is new. It just was time to finally have my own practice so that we could treat patients of all types and all needs. And I do see patients of all ages 4 to 84. There's a common misconception that orthodontists only see children, but that's not true. And then, so our flexible hours are really convenient. So we have evening appointments. We're open till 6 on Monday and Tuesday. We even have bright early appointments before work or school at 7 a.m. on Wednesdays. And we also are open every Saturday. So those flexible hours really can help work orthodontic treatment into your life, into your busy lives. I know everybody's busy. Right. And then finally, we're just around the corner. So again, appointments are every 6 to 8 weeks. And so if you're having to travel a ways, then it's just really convenient to be close by.
Right. So, we typically do a pre-interview conversation, and I was fascinated to learn this, that, most people, and I was in the same boat, think that, when it comes to orthodontics, it's just braces, but there's a lot more that's involved with your practice and what you provide for your patients. Can you tell a little more about that?
Of course. So braces are historically a huge part of orthodontics. And so orthodontics is about moving teeth, but it's also about moving jaws, especially in growing children. So braces are one method of moving teeth, and they've been around, modern braces have been around for almost 300 years. So they're definitely a tried and true method of straightening teeth and getting the bite correct. But also about 20 years ago, Invisalign was invented, which is clear plastic removable braces. And there's actually lots of different brands now, and I use different brands, including Invisalign and 3M Clarity. And so that's another way to move teeth around now. And it's nice because you can't really see it. So if you're looking at this model, it's actually wearing Invisalign now. So, and then another thing is you don't have eating restrictions, because with braces, if you eat anything too hard or chewy, you can break them.
Right.
So Invisalign's a nice option, but also because I also treat temporomandibular joint disorder, so TMJ dysfunction. If you're having any pain in your jaw joints, which are right here next to your ears, then I love, it's actually one of my passions to help people get out of pain. And so a lot of times the bite itself, and the bite is how the teeth come together when you bite down. If that is not correct, it can put pressure on the jaw joints and make them hurt or pop. And so just by getting the bite corrected, I can alleviate pain a lot of times in people. Finally, one of my other special passions in orthodontics is treating younger kids. And the reason that is because when you can catch a child while they're growing, you can make more of a difference in how their jaws are growing. So for instance, sometimes the bite is off because there's a jaw disharmony. Okay. So I can do orthopedics. That's the other part of orthodontics, is jaw orthopedics, which means re-guiding the growth of the jaws. And I can move jaws, and then I can get a more stable result once they have all their permanent teeth in. And that really, it doesn't even always involve braces. Sometimes it involves a simple retainer-like appliance. It just has a screw in it, and I can expand and make more room. So early treatment of younger kids is definitely one of my passions.
Yeah, and then, so again, a lot more than just braces. And I'm assuming that you would advise anybody with any sort of, abnormality or pain or jaw discomfort, set up an appointment, and you'll be able to have a consultation and let them know what's going on.
Absolutely. Like I said, it's my passion to help people get out of pain. So please come see me if you're hurting.
Perfect. So transitioning into something else that you're a specialist in is, I know you're considered a pioneer in airway orthodontics, which up till a few weeks ago, before my daughter started to come see you, I had never heard of. So, for the listeners out there, what is airway orthodontics?
So airway orthodontics is simply the idea that when you're treatment planning for your orthodontics, you're also taking into consideration how your treatment affects the airway. And what the airway is just the tube that you breathe through. And so that tube can be too small sometimes, and then you're not breathing well. So I can actually make a big difference in airway size in children by moving their jaws. You can't really do it much in adults without surgery, but so that's another reason I'm passionate about starting kids early, is because by doing the jaw orthopedics, I can open their airway and give them a better quality of life for their entire life, and even prevent sleep apnea. So that's what airway orthodontics is. And again, it's one of my passions, is helping people breathe better.
Right. And this is such an important topic. If you could just expand a little more on the importance of starting with children. So it sounds like things, if you wait too long, things could just develop to where you really can't expand or change the airway much, which can lead to, a myriad of health problems down the road. So, like I said, since it's so important, I really want to make sure, we hit home the importance of starting this process when kids are young.
Yes, that's right. It's extremely important. In fact, the American Association of Orthodontists even recommends every child being seen by an airway specialist orthodontist like me by age 7 or earlier, even like 7 at the latest. So, and that's because the earlier you catch the child while their jaws are growing, the more difference you can make. So once the child is hitting puberty, they're almost done growing. You can't really do that much about the jaw development or the jaw structure. You can still move teeth around and compensate for jaw discrepancies, but as far as opening the airways, it's really better to do that as young as possible, really. And I also want to talk about some signs of airway issues in children. So it's not always obvious that an airway can be a problem. So for instance, if you see your child snoring, that's probably an airway issue, and that's pretty obvious, but they don't always snore. Sometimes they're just breathing with their mouth open at night, and just breathing with your mouth open at night can reduce the amount of oxygen that the rest of the body and the brain is getting. And so it affects their behavior during the day. It affects their neurological development. And so it's not obvious. There's a whole list of symptoms. I can go into those if you're interested.
Yeah, again, maybe just hit on, some of the few blind spots that, again, you touched on the snoring, which might be obvious, but are there any other hidden signs, just maybe one or two, that people would be surprised to know about?
Yeah, so bedwetting or hyperactivity or aggressive behavior, those are all signs, especially if there's more than one of those combined. Those are signs that there could be an airway issue and the child's not breathing well at night.
Right. Just fascinating. Something you just never think of. There's a correlation between those two things.
Yeah.
So, and I know, that you're passionate about everything you do, but your passion with airway orthodontics, comes from personal experience, and you were inspired, to dive into this and do all the research and become the expert that you are. Can you touch on that a little bit?
Yeah, so originally I was inspired by my grandmother, who actually died from undiagnosed sleep apnea. So she had a stroke, and that strokes can be a result of sleep apnea, especially if you're undiagnosed and you're not getting enough oxygen at night. It can lead to a lot of cardiovascular issues. And so my grandmother was in her 60s, and so I didn't have a grandmother anymore after age 8 or something. I think that's how old I was. So that was really sad. And so I wanted to prevent sleep apnea as much as possible, make it more on the top of people's minds, educate the public about sleep apnea so that people aren't dropping dead from this silent killer, really.
Right. So, you touched on the recommendation by age 7. Is there an age you should wait to before neighbors have their kids checked out? Is there too young of an age?
Not really too young. The youngest I've started treating is age 4. But the research shows that if patients can tolerate it, you can start them as early as possible. The earlier you start, if they need jaw orthopedics, which is moving jaws around, not necessarily teeth around, the more stable results you get, especially when it comes to expanding the upper jaw. So if this is the upper jaw, there's two halves of it, and because there's a suture down the middle. And so that suture starts fusing together with age. So the younger they are, it's wide open and you can just push it apart and bone fills in, and it's really easy and it's really stable. But the older you are, you have to kind of break apart that suture, and finally in adults, it's completely fused. You can't expand at all.
Right.
So, and then there's also types of bites that it's better to see them at age 5 even. And those are a little bit more rare. But one sign of that type of bite is an underbite. So if the bottom teeth like this are in front of the top teeth, that would be a sign that you'd want to bring them in as early as possible, even 4 or 5.
Okay, great. Now, at the beginning of this interview, you had touched on, core value being you care about every patient and the community, and you guys have illustrated that by the clinic that you guys have built. So, how have you built your clinic to serve every member of the community?
Yeah, so again, we aim to be extremely relaxing, because a lot of people can have anxiety around dentistry. So we have a massage chair, but beyond that, we also have designed the office to accommodate people with neurological disorders like autism or traumatic brain injury or spinal cord injury. And the way we've done that is by having the patient be able to control every aspect of their environment when they're here. So we have color changing lights. They can put on whatever color makes them feel most relaxed. Or we can turn on the music or turn off the music, put it at whatever volume that the patient's most comfortable with. And we also have, for people that crave stimulation, we have special items in our office that you'll just have to see to help people that crave stimulation. But we can turn off all stimulation for people that get easily overstimulated. Yeah. So it's a really cool office, and I hope some of you will come check us out and take a tour.
Yeah, I mean, it sounds like you guys have gone to great depths, to provide that support and that comfort. Not knowing your industry as well as you do, is that quite common for clinics to go to that depths, or does that make you guys pretty unique?
Yeah, we're pretty unique on that front, and it has to do also with my husband, who's our CEO, Dr. Friedman, who has a brain injury. So he's also a brain injury researcher. And so we designed the office with that in mind. So people with brain injuries and people with autism have similar needs for their environment. So yeah, no other orthodontic office that I'm aware of has anything like this. And so you're in good hands if you come to us.
Absolutely, and good for you guys. So I know, transitioning quickly to the community, because I know that was, that's also a passion of your guys is to be entrenched in the community. I know we first met almost a year ago at the Three Creeks Fall Festival. How are you guys involved in Three Creeks?
So last year I was on the school accountability committee, and that was great. We just really like to be involved and help the kids whenever we can. And the Fall Fest was very fun. We raffled off some gift certificates for a percentage off treatment, and we had a great time.
So Dr. Friedman, beyond Three Creeks, you guys are involved in the other schools in the area too, correct?
Of course, yes. So we do believe in supporting our students, and so we're on the PTAs of actually several different schools, including elementary schools and high schools and all that.
Yeah, and then it's not just involvement with the schools. You guys also have a lot of family-friendly events that you host at your clinic. Tell me a little more about those.
Yeah, those are very fun. So we have painting club, we have hiking club or walking club, depending on where we decide to go, and biking club, as well as science night when there's no COVID pandemic. We haven't been having science night, but the other three clubs we're able to do outdoors. And the reason we do this is because we want to give back to the community, especially during the time of pandemic and people are feeling a lot of social isolation when there has to be social distancing, which really should be called physical distancing. Because really you don't want to isolate yourself socially. So we're trying to help bring the community together in a COVID safe way, and painting club outside, biking club, hiking club are all a great way to give back to the community for that. And then our science night, when we are able to have those, one of our values is education. So we really enjoy educating the kids and whoever of the community is interested in anatomy and histology, then we welcome them too.
So if there's members in the community and families that are interested, how can they get more information about these events and clubs that you guys have?
Oh, we have a Facebook page, and it's on our Facebook page.
Okay.
So you can find our Facebook page our address is Arvada Ortho. If you just type that into Facebook, you'll find our page. Yeah. And it lists all of our events and all of the dates, because each of these events are recurring. Okay. Every 4 weeks.
Okay, and I'll make sure that we have a link up in the description here. So, well, one more question. I end most of these interviews with, what would be one thing that people would be surprised to hear about orthodontics? Whether it's unique or shocking or whatever, what's that one thing that in conversations people are always kind of surprised to hear about?
So as you've probably surmised from this whole interview, orthodontics isn't just about straight teeth. So that's definitely part of it, is giving people a beautiful smile and a great confidence, but there's more to it. So getting a functional bite, so when your teeth come together, they're hitting properly and chewing properly so that your joints don't hurt, as well as opening airways. There's so much more to orthodontics than just a pretty smile, although the pretty smile is very important too. I love giving patients the confidence to smile with their new results.
Well, fantastic. Well, I can give a personal recommendation, as my daughter is one of your patients, and that started this summer, and everything that Dr. Friedman has been sharing about education and caring and going above and beyond, she's definitely lived up to it thus far. So I encourage everybody in the neighborhood or even outside the neighborhood to stop by and give them a call and tour their facility, because I think they're doing some great things in a correct way as well. So thank you for everything you're doing, Dr. Friedman, and thank you for taking the time to sit with me today.
Thank you so much for having me. It was a pleasure, and I look forward to meeting everyone.
Perfect. Well, that wraps up this episode. If you enjoyed this episode and want to follow all the other businesses, make sure that you like this video. If you want to keep up to date and maybe watch some past interviews that I've had with business owners in the neighborhood, you can track everything down at facebook.com/Candelas neighborhood. And if you're a business owner in the area, or you're a Candelas resident that own their own business and would like to do one of these interviews, feel free to reach out to me at dan@8z.com. So thanks for everybody watching, and we'll see you next time.